My name is Bruno Gobato, and this presentation is based on a master's course from Exactech, and the title is What Emerging Technologies Will Provide the Most Value in the Near Future. This lecture was based on a panel discussion from Ari and Stephen Brockmeyer from the United States, Remy from France, Sven from Australia, and Michel Simoni from Brazil and Switzerland. And this is the tech team that helped developing this presentation. These are my disclosures. And also a disclosure, it's important to say that all of these pictures in this presentation were AI generated. That's something that we will start beginning to see. We are not going to tell anymore what is the reference for that picture, but what prompt or what did I ask the AI to generate a picture. So for all this picture in this lecture, we use a stable diffusion technology, and we are displaying the prompts, which is what I asked the AI to generate that pictures you're seeing in the next slides. First, value, we have to understand value, it's relative to worth, to merit and importance, but to whom? So what technology will bring more value to whom? So to the surgeons, to the patient, to the healthcare. The patient will be the user of that technology. So for the patient, it's important to get good results, less pain, function. For the surgeon, maybe thinking about ergonomic, to be a better surgeon, fast, more reliable, maybe a better income, which is the client for that technology. And the healthcare or the society generally is the wallet who will pay the bills for or to use or not the technology. Our strength are in numbers, but for this presentation, we are going to take a look into the future. So this was a presentation done in Amsterdam. So let's use an AI-generated image with the Amsterdam landscape. And we invite everyone to discuss and to open mic and to comment about everything. I asked a very good surgeon, Dr. J.P. Warner, about his opinions, and he said it will be AI, immersive VR, MR, and probably other things that has in his mind. So we asked the AI, so I asked ChatGPT, what emerging technologies will provide the most value in near future for surgery? Exactly the title of this surgery. And this is what the AI answered. Robotics, augmented reality, 3D printing, AI, of course, it has to cite itself, and VR. And then I asked, but for arthroplasty, give me examples for arthroplasty. And he added computer-assisted navigation and wearable devices. Well, we already have some devices, computer-assisted surgery. We have the GPS for Exactech. We have the Predict Plus is AI. But we're going to say or to talk about AI, because AI will change everything. This is a quote. And this is a quote from the Google's CEO, Sundar Pichai, and says that AI is more important to humanity than fire and electricity. And the last keynote...
AI, generative AI is AI.
Well, the last Google's keynote was all about AI, and that's a meme that we are seeing all over the place. So we have in our portfolio some active intelligence, some AI products, but we're going to discuss other possibilities, what AI can bring for us as surgeon, for the patient. So let's discuss about these topics. So we can automate process. For example, we can use AI to automate process for us as surgeons to give answers to our questions, to be a surgical educator procedure, to have guidance in surgery or deciding which is the best. We can have an AI for a post-operative care. We can use it for research review, and we can use to collaborative decision making. So this is example. The Predict Plus is a platform that gives prediction of patients that will go to reverse or anatomical shoulder arthroplasty, personalized predictions based on 19 inputs that we give to the AI. But let's imagine that we want to use this prediction in the future, in the post-op. So imagine that we have a surgery in September last year, and the AI can understand that I'm typing that the surgery was 9 months ago, so the patient is 9 months post-op, and we can ask the AI, Siri, everything, what is the predicted visual scale of pain for today, for 9 months post-op? And she will look on the personalized prediction, and she will answer us what did she predicted would be the pain score for today, or what would be the external rotation or the forward elevation prediction for this time point. So we can understand if we are behind schedule with that patient, so we had to get a more intense PT, or maybe we are ahead of schedule and we should take a break even on PT. So the AI can understand every step of the patient based on the predictions she did prior to the surgery. This is an example how we can use AI, for example, to identify movement. So this is an example I did some years ago. It's very simple, but if we use AI, we will have the same results for the same methods of measuring elevation, external rotation. So AI is the question to standard the measurement of range of motion in shoulder. If we choose, or we as surgeons choose one AI to follow, we will have at least all the surgeons will have the same method of using and recording for the elevation, external rotation, and that will be very interesting for research. We can also use, for example, ChatGPT, which is an AI, to explain to our insurance why a patient with arthritis need a shoulder arthroplasty. And we can ask the AI to give reference. So the AI can give us the bad job, the things that we don't want, which is the paper job. So we can use AI. Here is a disclosure. The ChatGPT is very good in inventing things, so it is very creative, and it uses some reference that are not entirely correct. So if we're using ChatGPT for writing, that's okay, but check the reference. It's not always correct. We could use AI to learn from other surgeons. This is example of Dr. Zuckerman, or maybe PH Furam in France. So I used some lectures from Dr. Zuckerman, and I trained AI to sound like Professor Zuckerman. Let's listen.
Hi, my name is Joe Zuckerman. As you noticed, I am not a human, but a robot voice clone. I imagine I've lost my sense of humor and my charming New York accent, and probably I'm not as good at jokes as original Joseph. Nevertheless, welcome to Master's Course in Shoulder Arthroplasty.
Of course, it's not as Dr. Zuckerman, but it's very close. So now that I can clone Dr. Zuckerman's voice, I can make him say anything we want. So this is the power of AI and how impressive it is. We can ask AI to answer specific questions. For example, this is the AI that I feed with 10 articles. I tried to 10 articles, and now I'm asking questions about these articles. For the first question I'm asking, what is the incidence of aseptic glenoid loosening? So it will look at these articles and answer. And what's the incidence of acromial fractures after reverse total shoulder arthroplasty? And the AI can answer very correct. That is 1.552%. We can ask an AI about the yesterday lecture that we have. So I have recorded the lecture that we have in the day before from Dr. Joseph Zuckerman, recorded using my smartphone. I transcribed that recording using AI, and then I feed all that information to the AI. And now I'm going to ask questions about the lecture that Dr. Zuckerman did in the day before this presentation was made. So this is the video, sorry, that you can see. And we are asking about the infection rate. We are asking how many patients were in the database that he mentioned, and the AI could understand exactly what we are asking about from the lecture. We can ask about specific questions. For example, what is the 8-year survival for an anatomic shoulder arthroplasty? And the AI can look at that and give also her prediction of how sure she is when answering that question. In this case, she is answering with some 99% of sure that is the equinox. We can create art. So this is art. These are pictures that we created specific for this presentation. And AI can create persons. All these persons that you're seeing in this video are not real persons. These are all AI created. There is a database of over 2 million persons that does not exist, and you can look at online. So if an AI can create a person, maybe AI can generate specific cases. These are examples of a shoulder, the X-ray of a shoulder that I asked AI to create. The first image is from the internet, sorry. The last image in the last row are the images that I asked the AI to create. As you can understand, it's quite not there yet. We can see that one image has 2 bones on the humerus, so it's messing around. But that's because we have very few X-ray of shoulders in the internet. We have lots of thousands, millions of knee X-rays. So for knee, it's easy to create. These are knee creations of AI. For shoulder, we are not that yet, but I'm pretty sure if we train AI with lots of X-rays, of shoulder X-rays, we will be able to generate and to create specific cases for us. These are examples of other AI-generated pictures that I asked specific about shoulder, and you can see that the anatomy is not that perfect. The images are beautiful, but not reliable to the anatomy. But maybe we could create personalized cases. For example, if you want to discuss a specific pathology, a specific scenario, for example, maybe do legal problems, do unauthorized image use, we can create. We have here behind my video a picture of a lady that I has asked AI to create. So this lady does not exist. This is AI image of a 59-year-old lady with shoulder pain. So maybe in the future, we can create the X-ray, the AP in the lateral view of a 59-year-old lady with a B2 glenoid with a forward elevation of 120. So if we give that information, we can create personalized cases for discussion. We can also create personalized 3D models in the future. I tried. 3D models are very difficult to create, but we are starting to feed 3D models to AI. They are very simple yet, but I understand that is just about feeding the specific AIs about the shapes of the scapula, for example, and we'll be able to create and generate actually 3D models of scapulas and scenarios for in silico tests, for case discussion, for everything that we want. We can create a PowerPoint presentation in less than 1 minute. So this is me asking to create this presentation. So I asked ChatGPT, and ChatGPT created, this is live. So this is what I asked, and this is what ChatGPT create. I asked for 5 slides. So the AI is young, she's rebel, so she only generated 3 slides for me. But this is a PowerPoint generated slide that was done in less than 1 minute. We can create an AI for a chatbot for postoperative orientation. So I fed the AI with some information that she would ask the patient, and based on the patient's answers, she should give some information. So I asked the AI to always ask when the surgery was done, because she should orientate the surgeon, the patient, to use this link at least for 4 weeks. I asked the AI to ask about fever. I asked the AI to ask about pain and give some answers based on the patient's questions. And she's quite smart with just a very few information we fed. This is a chatbot that was created under 20 minutes talking to ChatGPT. And maybe we could send our patients for a virtual PT. This is probably something that AI would be able to do too. Well, we see value from different aspects. So we as orthopedic surgeons, we can see value different. So it's different how people see us and different how we see ourselves. So value is very different for everyone. Let's talk about robotics. Maybe robotics is precise, better, less invasive. Well, robotics for shoulder arthroplasty will be a challenge. This is an example that we used VR. So we imported a model of a robot that is in the market. And here we are exploring how we could incorporate that robot, since it's not exist for shoulder until the recording of this presentation. So this is the patient in a beach chair position. In blue, you can see this cone that is where the area that the robot will be able to use. This is the navigation system, and here we can see the auxiliary, the doctors that having the surgery to assist the assistants, and me is the surgeon myself. And in this video, we are trying to understand if a robot would fit in the OR. So first, how would be the angle for the robot to reach the glenoid? And that's what we are trying to understand here, how the robot would move to fit to prepare the glenoid, for example, and how would us, the assistant and the surgeon, would have space in the OR to have this robot, this giant robot, next to us. It would be not a very easy task, but we think that would be possible. We can create our own robots. This is a very cheap, small robot arm that I assembled myself. So robots does not need necessary to be very expensive. Of course, this is a prototype, but we can use small robots for small tasks. This is a $200 robot arm that we could be using for some tasks in surgery. This is a drill that we attach to that robot arm, so we can ask the robot arm to perform specific questions, in this case, drilling a part of glenoid. So the robot arm can, a small robot arm like that, a very cheap robot arm like that, would be used in the future for specific tasks for shoulder surgery. And the future or the present is VR and AR. So you are seeing here an example of a mixed reality or augmented reality for shoulder arthroplasty. So we can preview our planning during the surgery, as you can see here. We can preview everything, and we can even use specific guides to develop to provide our surgery. And we can also use VR. So this is a patient in a beach chair position. So we are using here VR to understand what we are going to do in every step of the surgery. And we can also use VR for planning surgeries. We are used to use computer softwares, but we can start using VR to plan specific cases for us. In this case, we are planning the humeral osteotomy, and when we have already planned the implant position in the glenoid. So these are the future uses for technology for shoulder arthroplasty. Thank you very much.